So coming to question number 9, what are the recommendations for using Galileo at home? How often should it be used during the day? So the typical setting is normally maybe twice a day, 10 times a week. This is a typical setting what is used in the Cologne hospital. So normally, for instance, they try 1 times during the week and maybe 4 times at the weekend. This is something which is normally feasible to do with the children because the children normally go to school, they have other activities. So, and I would say the minimum would be minimum 3 times a week. But normally, if you have the machine at home, you can use it daily, no problem.
And I think that I could add that the problem is that those children that have different neurological problems, their daily physical activity is just dramatically decreased. And you know that there was an investigation in the United States about the toddlers, so children between 12 to 18 months old, that during the day they did average, I think, 14,000 steps.
Correct.
And they also fall so many times, and then they got up again, and it was around 100 times, which is very important for the gluteus muscles and all the muscles surrounding the hip joint, and actually for the hip development, as a bone structure. So that's why, again, I'm very glad that we can use such a plain device, I would say, to create this activity that around the joints that we need to actually develop normally without such a difficulty, you know. So the parents can do this in several minutes. They can activate the muscles and at least know that they support the bone growth and direction of the bone. I mean, we know that the geometry of the bone depends on the muscle or the work of the muscle. So that's why we can create those forces, you know.
Just to add to this, normally, for instance, if you are training with 25 hertz, you make 25 muscle contraction per second, 1,500 in a minute, or 4,500 in 3 minutes. So here you get the intensity which is normally needed for the neuromuscular system. Of course, it's not replacing the functional part, but
Yes.
that the system learns to communicate, that you strengthen the system. This part can be fulfilled with Galileo, and especially if you have a hypertone child or children which are sitting in a wheelchair or something and are immobile, then the Galileo is really a tool to activate these children. Okay, so continue with question number 10. Is it allowed to use Galileo with patients who have gallstone and bladder stones? Well, gallstone and bladder stones, if you have larger ones, if you are moving, and this is a general risk, you can lose gallstone and bladder stones. And if it's a larger gallstone or bladder stone, then you get a stenosis, and then you might have a surgery. And of course, this is the same thing with Galileo. So if somebody is exercising, there is a risk of losing this gallstone, bladder stone. If it's a small one, no problem. If it's a larger one. So again, this gallstone and bladder stone is a general risk when you are moving, not related to Galileo. And you have to be careful if you have larger gallstones or larger bladder stones. Until now, we had one patient who had got a bladder stone, I think, and got surgery. But this is, again, it's not related to Galileo. This is something it's happening when you are exercising in general or moving. Coming to question number 11, clinical case, the patient 2 years old with terminal stage of chronic renal failure. She has hypotonus in the leg and she doesn't walk. Nephrologists suppose that if she starts walking with the help of physiotherapy, then it could influence and develop the blood flow around the kidney. can we use Galileo in such case? And of course, yes. We have done already one study in people with kidney disease, and it shows very positive effect in general on the mobility, but a lot of effects in the body are also needs the muscle system to squeeze blood, etc. And therefore, it could be helpful to use the Galileo in these patients. How much the effect is on the renal system or on the kidney itself, I think it's not so big, but the positive side effects you have with using Galileo, like this nephrologist said, I think if you have more activities, there's a better also organ function.
Mm-hmm. And also maybe I could add only that because of the lack of the activity, physical activity, we have a significant negative effect on the overall physiological function, including heart and blood flow and lung function or liquid distribution. So
Yes.
that's why I think it would be very good again to do this.
Yeah. Coming to question number 12, is there any time limit for working with Galileo for specialists in clinics? No, until now, again, if you look in all the clinics, people working with Galileo, let's say with their patient in a standard routine, doing their 8 hours job, and they're using probably the Galileo minimum two hours, 3 hours, and we never have seen any negative problems for the people who are working with the Galileo, with children or with adults. That no, therefore no time limit. Coming to question number 13, is it safe for pregnant women to work with her child on Galileo? Well, the pregnant woman, of course, not herself, but to work with the child, and the pregnant woman is beside the Galileo, absolutely no problem. And again, if you look in the literature and also as medical device, no problem was reported in the last 20 years that somebody has seen a negative effect when pregnant women, and a lot of these mothers which have young children, disabled children, they get a second child or something, they are pregnant and working with the child in a normal, and we don't see any problem.
By the way, I worked with Galileo when I was pregnant twice and there were no problems.
Okay, good. That's good to hear. Yes, thank you very much for the comment.
So one of us
Yes.
experience. You know, maybe I would suggest at the beginning to interview the mother and make sure that she doesn't have herself any negative anticipation.
Yes.
And then maybe I would suggest her not to put her legs on the platform that we sometimes recommend parents to do, but with hands and with arms, I think it's all right.
Yeah, well, basically, the variety in pregnant women is quite large. There are women which has to lay down after the third, fourth month because they have a certain risk. On the other side, there are some pregnant women who are doing sports up to the 8th or 9th month. So, and we ourselves had an employee in our company who was pregnant in the 9th month and thought, well, now should the baby come? And he went on the Galileo, but well, the stomach went hard, but there was nothing happening. But basically, we say no, that pregnant women should go on the Galileo, but working with the child with Galileo is no problem. So coming to question number 14, is there any protocol of exercise on Galileo for patients with oncology diseases? Yes, in Germany we are meanwhile, I think minimum 6-7 universities with oncology department which are using the Galileo because they see the benefits using the Galileo in patients with cancer. And the main goal in these patients are muscle weakness, to strengthen the muscle, reduction of neuropathy pain, so that they can use less pain drugs to improve balance and reduce the fatigue during the daily life. And especially in Cologne, they have a special training therapy program for cancer patients. And the Galileo is part of this program, because here you can train these patients in a short time, and they see this positive effect in mobility and reduction in neuropathy and less pain drugs.
Mm-hmm. And also, Harald, you told me about the comparison in the study, in comparison of Galileo to other devices like bicycle, or what was else? What it was? I think it was some exercises with weights. And in this study, I think the comparison was with tests, blood tests also, that shows that weightlifting wasn't good for the test results. And I mean that we still have this idea sometimes, still I think I hear about this, that real activity, you know, physical activity for the people after oncological, or when they have the oncological situation, it could be harmful. So could you say something?
Yeah. So, well, the only risk we had at the beginning, that by having these activities, you are maybe spreading these cancer cells in the body. But this is meanwhile proven that this doesn't have any influence by doing Galileo training. So you can do the Galileo training and you are not spreading the cancer cells in the body, and that you make cancer more severe. Now the positive effects are clearly there. And now they're starting, even children which, let's say, getting chemotherapy or are isolated in the clinic, they are also using Galileo to train them, because this is normally then the only way to train children in an isolated room. So I think it's a perfect tool to train people where the immune system is reduced and they're anyway limited to the room where they have to stay to get not any infection. And then the Galileo training would be a perfect tool to train these patients.
And also psychological aspect, you know, that they can feel that they can do something, but it is not hard, but they can feel the result pretty soon, so it's a short period of time. And in Russia, with your help, of course, you know that I participated at the conference 2 times about, those conferences were organized by Habensky Foundation. And we have in our praxis a lot of children supported by this foundation. So we also use Galileo on a daily basis. And so hopefully it will be more studied in the future, and we can use it, I mean, more widely.
Yeah, absolutely, because in the moment, in a lot of countries, the doctors see only the cancer, but they don't see the side effects, or they see the side effects, but they're doing nothing against the side effects, that you're immobile, etc. And this getting more and more a focus, because again, the muscle is important for the immune system. And if you want to strengthen the immune system, then you need good muscle function again. So between immune system and muscle function and activity is also a strong relationship. And this is probably not very well investigated until now, but the immune system also depends on good muscle function.
So, and you know, Harald, just to add to this, I really appreciate that now it's around 500 different studies and investigations. I mean, I'm so proud that I'm presenting here the company that are really doing a lot in this field. So that's very, very supportive, and thank you very much on behalf of all the you know, patients from Russia. Thank you.
Yeah, thank you very much.